So thank you so much for joining us for our World AS Day 2026 campaign kickoff webinar. It's fantastic to see so many of you here. For those of you who don't know me, I'm Jo DeBry. I'm the Communications Manager at ASIF, and I work very closely with Joe Davis, the Director of Operations, and Joe Lowe, our Project Manager, who is here with us today. We're delighted to see so many friends from around the world. Lots of people representing our member organisations, as well as representatives from other international groups, ASAS, IFCA, Global Remission Coalition, etc. And we also have representatives from our industry supporters. So thank you to everybody for making the time to come to our webinar. We're really excited to share the campaign with you and to show you how you can use it to raise awareness with your local communities. It's going to be a really exciting campaign. Next slide, please, Aga. So just a few housekeeping points. Please do mute yourself during the meeting. If you've just joined us and you haven't yet, please say hi in the chat, pop your name, organisation and country down. If you'd like to ask a question, please raise your hand using the hand icon or type your question in the chat. And we are recording the meeting and it will be available to those people who can't attend live. So if you prefer not to appear on the recording, feel free to turn your camera off. So why are we here? What is World AS Day and why do we need your help? Well, in just 73 days, it will be the 2nd of May and World AS Day. It's coming around very quickly. Many people joining us today are World AS Day veterans. You know the campaign or you know the idea behind it. But for those of you who are new to the campaign, it's our annual opportunity to bring everyone living and working with axSpA together with one global voice to raise awareness around the world about this chronic condition. We know that despite affecting 1 in 150 people, most people have still not heard of axial spondyloarthritis, and World AS Day is our chance to change that. Together, we realise that by making a coordinated effort, having a time frame, a theme, a set of key messages focused on a particular aspect of life with axSpA, our collective voice is louder. We know that together we're stronger. So over the years, ASIF has used social media to raise awareness with different audiences, including healthcare professionals, policymakers, and the general public. We create a suite of editable materials that can be localized and translated for use with your local communities. And the assets are designed to be used by our members and supporters, as well as people living with axSpA to raise awareness. Last year, the theme was Lace Up for axSpA, and it shone a light on the everyday challenges faced by people living with the condition. And with your support, we reached around 24 million on social media, which added then to the number of people who learned about axSpA through your events and activities. We know that the actual number of people who learned about axSpA is so much higher. We created a powerful video last year about the everyday challenges caused by axSpA, featuring people from around the world. Percival was featured in it. I know you're here today, Percival, and we're really grateful to everyone who's been part of the campaign in that way. We also created a suite of resources for our members and supporters to use, and they were translated into many languages, including Spanish, French, Italian, Norwegian, Hebrew, Brazilian, Portuguese, and Arabic. And as always, all of our materials for this year's campaign will be available for translation to make them as accessible as possible for your local communities. Each year, World AS Day grows and more awareness is raised, which is really exciting. So this year, we've worked again with our friends and colleagues at Platform, who we'll introduce in just a second. Platform's a creative agency that's worked with ASIF on a number of campaigns in addition to World AS Day. Ravi and Aga are great and work wonders in the development of our campaigns. We engaged the World AS Day subcommittee again this year, and that's made up of representatives from our member organisations and is led by Prachi, who many of you will know from Ankylosing Spondylitis Welfare Society in India. Prachi is also one of our ASIF trustees, and she's actually going to join us in the afternoon session later on today. The subcommittee worked closely with Ravi and Aga to guide and develop this year's campaign. And that's really key to us, is to make sure that the campaign is relevant to everyone around the world. As you know, each year we have a different theme, and previous themes have included emotional well-being, the importance of movement, signs and symptoms, and as I mentioned last year, Lace Up for axSpA. And Lace Up for axSpA proved very popular, and so we've actually weaved it into this year's theme again. Although it's not the main theme, it's part of the campaign. And I'd just like to take the opportunity to say thank you again to Marco Garrido Cabrera and Ciade in Spain for allowing us to use their concept of the orange shoelaces. I'd now like to hand over to Ravi and Aga, who will tell you a little bit more about the campaign.
Wonderful. Thank you, Joe. It's very nice to connect with you all again here. Some of you have become people we know for many years, and there are a lot of new faces there as well. So I'll tell you a little bit about us. We've been supporting the subcommittee, the wider team, to create the content to really empower you all. And we really want to make sure that we support you. So hopefully what we're about to show you over the next 10 slides or so empowers you with what we're doing, why we're doing it, how you can help. And I'm going to split the session, introduce the high level, and then Aga, my colleague, who's going to go through all of the different assets that really hopefully make a difference. The theme for this year, not only back pain, the theme is very direct and very clear. This is not only back pain. Very simple message, but really goes into the detail. It's stiffness, it's fatigue, it's pain, it's beyond the spine, and it's a daily struggle to move. It can also affect so many other things: joints, eyes, gut, skin, as most of you already know. And this year's theme, not only back pain, consolidates all of this and includes content that includes all the things that patients, many patients go through, from psoriasis, IBD, uveitis, depression, anxiety, fatigue, and other things. And so this year's theme challenges the misconception and shows the full impact of the condition that makes the invisible visible. So hopefully you like the theme. It's a great theme so far. We've been working with it for a few months with everyone, and hopefully the content that's been generated is something we hand over to you and support you with now that the campaign lives on. So what do we mean by helping you with the campaign? So our team every year creates a new logo, a toolkit giving you key messages, why we're doing this, how you can help, various assets in editable format in Canva, social media covers so that you can start immediately after this meeting, letting people know, save the date, etc. Website and email banners. And we've added a couple of new things this year. We've produced a short filming guide. Hopefully you can use that to encourage others to share their stories. And also an AI guide to give you an overview of how you can use AI to really localize, personalize, and adapt the campaign assets that we've shared. So a little bit more, hopefully, each year, trying to help you make as much noise as possible for this year's campaign. The logo is something that we really do love, and we'll come to that in a second. Official hashtags, even if you only do one small thing, if you do it, please do share with the hashtag. The hashtag allows us to see everything that's going on. It really powers you up. And any a patient or a carer looking at somebody's post, if they click the hashtag, can go and look at all the others. So please use hashtag World AS Day 2026, hashtag not only back pain, and hashtag Lace Up for axSpA. This is this year's logo. We have used, for those of you who've been tracking the campaign for several years now, you'll know that in order to keep things fresh, alive, break through the busy noise of a social media morning newsfeed, we changed the logo, and this year we've used shades of orange. And that's really to indicate all of the different things that can happen as well as back pain. So there's a variety of symptoms and challenges that someone can go through. And as per last year, we've animated these dots, and throughout the content, you'll see animations to keep things alive. And we do that to um, really gain some traction in the viewer habits on the news feed and stop them to pay attention to things. All of these logos, etc., are available to you. We're really, really proud to have been asked to meet with many people this year in order to create some films that can really raise the voices. And just yesterday we completed filming, and our local teams around the world have filmed in Norway, India, in the UK, Philippines, and South Africa. And honestly, as these videos are released from today onwards, I'm sure that you will see that these are something special. Real patients talking about their lives from the perspective of not only back pain, messages of help, hope, inspiration, support, guidance are all coming your way. They are all recorded in English, but if you want a translated version, please let Joe Dupree know, and we will see, as with previous years, how we can help. But me saying that they're exciting is not as good as me showing you. So we have a little teaser, which if you put your volume up, you should be able
axSpA
to.
is more than back pain. When I was at the gym, I experienced this incredible, intense pain when I was lying down on the bench to do some bench press. But my main problem, as I see it now, is the fatigue. It's an invisible symptom for others. Illness has been difficult to cope with. Telling my story now, I hope it will give meaning and hope for others, because there are so much more than having axSpA. World AS Day is just around the corner. Let's raise awareness together.
I don't think Rebecca is here with us, and that is just a teaser. And Rebecca's story is quite incredible and inspiring. And our video camera guy had to follow her around the mountains and forests of Norway while she was on her motorbike. Um, a really quite inspiring story. And so we have 5 videos with 6 people in them, discussing everything from uveitis to complete immobility to multi-generational axSpA. So please do look for them. Please use them. Please be inspired by them to share your own stories using the guide that we've got. And please, if they need to be translated, please let us know. We live in a world where these things are becoming easier. We want those videos to be loved and used and shared to create noise and to be a springboard for your own activities. We took the success of filming in the real world last year and the year before as a sign that this type of work really works. And so having 5 times the amount of video content than you've previously helped hopefully will be interesting. Timeline. We're hoping that we've started early enough for you all to have time to make noise. So from today, the website is live. You can visit the website now and start downloading. Please do have a look. And between now and the 2nd of May, ASIF will be doing its own sharing of information. But really, this is about you taking what we're providing and using it for yourself. So have a good dig around and look around the assets. And we hope that it helps you plan your local events, your digital noise, your real world meetings. And we all come together on the 2nd of May and make as much noise as we can. There are also the Global Summit happening on the 1st of and the 2nd of May, and Walk Your AS Off from 3rd of May onwards. There'll be a period of all of these messages traveling before we summarize them, and hopefully together we create even more noise than ever before. So on that, I'm going to hand over to my colleague who's going to talk you through all the different assets. But just as a wrap up, use our assets, promote World AS Day. It is an expansive theme, and so everyone, I can see members from related areas. This is a year we really are talking about, and trying to capture as much as we can that impacts the patient. Use the hashtags. Tie your laces. One of my fondest memories, Marco is on the call, who created the campaign with the laces. He's playing football with him last year, filming him with orange laces on the top of a hotel in Seville. This is a fun campaign. It gets people talking, moving, and tying your laces really is making a difference. Share your story. We've prepared a guide. You've heard other people's stories. These things travel well. In a world where content is increasingly becoming difficult to know whether it is artificial, digital, AI, these are real patient voices, and real patient voices make a difference. Hopefully our guide will help you. Organize your own events, share them, share your knowledge with each other, share photos, videos you capture. We can help promote. If you see something from a different member country's post, share that, like it. And most importantly, this is for you. So adapt it in a way that works. I'm going to let my colleague Aga take over now and go through all the different assets. Is that cool, Aga?
Thank you, Ravi. Thank you.
Cool.
So my name is Aga. I've been part of Platform, the agency that is responsible for all the assets, and we've been working with ASIF for many years on developing the campaigns. So I'm really happy to see so many of you here today, and very excited to show you what the campaign is and seeing everything, going live and global. So starting off with our website.
Aga, so I was
Yes.
just going to let you know, your camera's off. I don't know if you knew that.
Oh, sorry. Thank you. No, sorry.
It's
Thank
always
you.
nice to see your face. Thank you.
Thank you. So the website is the central hub of the whole campaign. It's already live. It has all the information regarding the campaign, and I'll go through everything one by one now. As you can see here, the theme is, the main part of the website and the campaign, with the logo being animated. Everything is available for you, like Ravi mentioned, and I'll show you in a moment our resource guide. So everything basically connects to this website. We have a little bit information about what World AS Day is. It explains why it matters, outlines that it's an annual event. So for all of those who will come to the website for the first time, or they will hear about ASIF or axSpA for the first time, we wanted to include all that information again, to make sure that everyone gets all the basics from the start and no one is confused, and we'll do that throughout all the social media as well. So if you see things repeated, it's still the aim is to educate as many people as possible around the world about axSpA. We also go into more detail about the team, and why the team matters, and what we are trying to explain and what we are trying to highlight this year. We also have some symptoms listed and links to the symptoms checkers for those who will come to the website and try to find a little bit more information about axSpA in general. Then we have real voices, so the videos. We are very excited to share them with you, and like Ravi said, filming with everyone, all the patients. We actually filmed yesterday in London, so I'm in London in a small hotel room actually right now. So we just filmed yesterday with Akash. Really, really lovely to hear his story. So every single story is different, and we are really, really excited to show you, how it will all play out, and we will keep posting them here on the website, but we'll have also some short teasers for social media that will be available for you as well, and for translation as requested. We have also prepared a short toolkit to encourage people and to kind of give them confidence on how to share their stories. It's very simple. It has all the simple information on how to set up your camera, what to use, some example questions, and we have it in the PDF format as well as a short video with the little orange character that we used a couple of years ago, and we are trying to keep him alive through all the assets. So hopefully this will be very helpful for everyone, and this will be available for you as well to share on your socials and to come in and download the guide. We keep LASAT for axSpA still alive, and we loved the initiative last year, so hopefully people will still be able to share their pictures and videos of the orange laces. And then we have all of our key messages, so it summarizes all the main campaign points. They focus on raising awareness, recognizing early symptoms, improving understanding of the comorbidities, and advocating for better care and support. We really recommend using these key messages across all your communications, and you will see as well, like in all the assets that we have, we use all of it as well, so you will have access to everything. You can just copy it, adapt to your needs, translate them as you see fit. So we have 6 of the messages here. You can see we've used some of the pictures already from the filming. So we have lovely Miranda and her son Jack that we filmed in South Africa here. So you will see some pictures in the social media posts as well, and all the assets coming up. Then, as every year, we have our global events section. So the section allows everyone to go in and submit their event directly through the online form. It's very simple, very easy to use. You just put in your details, your time zone, and then it's going to automatically add to our website when it's been approved. So we really encourage everyone to use it to add their events here as soon as you have your details, and also to come back and check in as well, to see what everyone else is doing and maybe joining the many events that are happening online as well. So we encourage you to come back to the section as well, just to check in and see what's everyone planning as well. And coming to one of the most important parts of the website is our resources. So as every year, we have all the resources available to you to download, and also in Canva format. So we have the toolkit that brings together everything that's the campaign is about. It's a PDF, so you can download it, and you can also always have it, on your computer handy. It has again, all the key messages, on the background information, visual guidance on branding, what fonts we use, what exact color we use, any practical tips on how to use assets. Everything is there linked as well. We have the logo in all the formats that you need, that you can download as well and use in your assets. And all social media assets, including covers, banners, and posts, are also available for you to download directly in English. But we also created them in Canva, so you'll be able to translate. But for ease of use, you can just simply download the whole folder to your computer and use them like as they are. Now, we have linked here our social media schedule. This is a live Google Sheet that will keep updating throughout the campaign period. It's a document that you will find all the posts linked here, with every single channel listed with the copy that ASIF will be using on the social media. And you're welcome to use all the content in full to copy and just post on your socials, or you can just use it as a base, translate it, adapt it, adjust the wording to suit your organization and your audience. So we recommend checking in regularly, as we will be keeping this sheet updated and alive. So we have already outlined quite a lot of posts here, but obviously the videos and a few other bits will be coming here. So once you have the link to this sheet, whenever you come in, it's always going to be live and updated by us, and you can make a copy of it as well in over here, and then you can use it as well, adapted to your needs. So you won't be able to edit this one in particular, but you can make a duplication of this document, and you can keep sharing it with your colleagues as well, and adapting everything for your organization. Then coming a little bit further, we have Canva editable assets and Canva editable covers. I'm not sure if everyone have used Canva before, but it is a very, very simple tool. It's free as well. There are paid versions of it, but I think using the free one will be more than enough to just adapt the assets. We created them as a template, so every time you go in and you click here at the template, it will create a duplication of those assets for you. So you can, in this project, you can adjust and adapt everything as you wish. No one's going to have access to this, so you don't have to worry that you messed up anything for anyone else, and also that no one's going to come in and do anything for your assets. So you can adjust the images, you can adjust the text by simply clicking here and adding your translations or adapting the assets to your organizations, adding anything that's needed. All the posts are listed here with so you will be able to see the in the schedule they all duplicate and coordinate with each other, so it's quite easy to use. We try to create as many as possible. We try to use different images as well, so hopefully this will be easy for you to use. And the same with social media covers as well. We have them in the same kind of format. You can go in and use your translation. We have save the date ones that you can use straight away on your socials, and just the regular ones that once everything is alive, and you don't need the save the date bit, you can use them as well straight away. It's for Twitter, LinkedIn, and Facebook, and the same with website and email banners as well. Here we have once again linked the guide to sharing your story, so it's the PDF, and then we also created a AI guide. It's a very simple, practical document. It explains how patient organization can use and leverage AI tools to support the campaign activities. It shows how to create captions, adapt the tone of the messages. There are some simple prompts as well that you can use and start with. It's you can download it and check and see what works best for you and for your organization. We kept it very simple, but we wanted to add something to the campaign, and to not scare too many people as well. I'm not sure if you were joining one of the webinars that we did on AI, but hopefully this will be a good start, and it is going to help to speed up as well, and make your life much easier, like it is ours, to be honest. So that's all on resources. We have our Get Involved section that Ravi already mentioned. Again, we're asking people to share the story, lace up for axSpA, share everything with the hashtag, connect with local organizations with the link to the ASIF members, so they know which organization it's in what country. Call to action to join or host the event, and obviously use other resources. And then last but not least, we have some information about the two events that are happening. So the Global Summit with the link to the website, and the Walk Your AS Off. And that is again back in 2026. So hopefully everyone will be able to join as well. So coming back to the presentation, we walked through the whole website and all the assets, but once again, you can see we have the toolkit here. We have all the social media posts in static format, and we'll have the videos as well available for the translation as you wish. All the covers, all the social website and email banners. Again, we encourage everyone to add their events and check in and see how everyone else is doing globally. So I think that's all in terms of all the assets. So please let us know if you have any questions.
Thank you so much, Aga. I can see Margaret has asked a question. Ravi's actually answered it in the chat. It was just about the orange shoelaces. Some organisations in the past have ordered bulk shoelaces and have either sold them or given them away. I know the SAA sell them in their online shop. Others, it could be easier just to suggest to people who want to take part just to buy them on Amazon. They're very inexpensive on Amazon or other shops, but just go and pick up a pair of orange shoelaces. So it depends on what your organisation wants to do. There's a number of different suppliers. We don't have a set one. If anyone has any other questions, obviously feel free to pop it in the chat. I can't see any hands raised at the moment, so we might continue if that's okay, Aga. So we'll move on to the Global Spondyloarthritis Summit. So this is an SAA event that runs each year. Kristen has created a short video for us as it's the middle of the night in the US and she's fast asleep. She's going to join us for this afternoon's session. So I'll let Aga press play and tell you a little bit about the summit.
Hello, my name is Melissa Velez, and I'm the Director of Programs at the Spondylitis Association of America. Thank you for taking a few minutes today to learn about our upcoming 8th Annual Global Spondyloarthritis Summit. The summit will take place May 1st and May 2nd this year, and the theme is Living Well with SPA, Practical Approaches to Everyday Challenges. I'm going to briefly walk you through what the summit will cover and why it may be valuable for your members to attend and to help promote. We know that people living with spondyloarthritis face challenges that go far beyond pain. They manage mobility limitations, fatigue, work and career concerns, strained relationships, and mental health impacts. Many people tell us that after their diagnosis, they still feel unprepared to manage daily life. This summit is designed to fill that gap by focusing on practical, usable guidance that people can apply right away. The summit is a 2-day virtual program designed with accessibility in mind. Each day includes short, focused educational sessions led by experts. Every presentation is followed by a live question and answer session, so attendees can get direct real-time guidance. We also build movement directly into both days, recognizing that physical activity is a core part of managing SPA. Friday's agenda focuses on physical function and everyday responsibilities. Topics include mobility training with David Smith, an overview of spondyloarthritis with Dr. Maureen Debrell, and movement and exercise guidance with Emily Clark. We also address workplace and career adaptations with Yelise Pryor, aging with SPA with Dr. John Revelle, and family relationships and intimacy with Tina Mansfield. This day is designed to help people manage how SPA shows up at work, at home, and in relationships. Saturday focuses on sustaining health and quality of life over time. Sessions include Pilates with Shane Rhodes, the latest in spondyloarthritis research with Dr. Christy Kuhn, energy and fatigue management with Emma Durez, and we also cover nutrition and anti-inflammatory diet strategies with Christina Montoya, mental health and resilience with Antonia Rapollet, and integrative and complementary therapies with Michael Mahler. This day supports long-term coping and whole person care. In addition to educational sessions, the virtual platform includes interactive features. Attendees can explore a virtual exhibit hall, visit the activity lounge, and network and chat with others attending from around the world. Sessions are also available on demand, allowing people to participate in ways that fit their schedules and energy levels. We hope that you will join SAA on May 1st and May 2nd. The live sessions will be broadcast beginning at 8:30 a.m. Pacific Daylight Time and will end at about 3:45 p.m. Pacific Daylight Time. This is a free online event open to all people impacted by spondyloarthritis. We hope that attendees will take away helpful tips and tools as they manage SPA. Thank you for your time today. Please feel free to reach out to us at info@spondylitis.org if you have questions or need more information about the summit.
Thank you so much for that recording, Melissa. We'll share social media posts about the summit, and we'd love it if you shared them on with your own communities. The content for the summit is always excellent. It's free and it's aimed at people who are affected by axSpA. So we would really encourage you to share and advertise it to your local communities. So that is the first of the SAA's events. And if we move to the next slide, Aga. Thank you. So the second is Walk Your Ass Off. So Sean is also fast asleep in the US at the moment. He'll join us again this afternoon. So he's recorded a short video about Walk Your AS Off.
Hi everyone, it's Sean Ewart, Director of Member Engagement for SAA. How you doing? I wanted to check in with you and give you a few updates on Walk Your AS Off 2026. And we have a special announcement that we have created a Walk Your AS Off Day. It's a special celebration during May 2026, which of course is World AS Month. It's Sunday, May 3rd, 2026. And we're hoping you'll join us as we welcome walkers from around the globe. So you'll have to register for a Zoom party, which will run virtually from 9 a.m. to 6 p.m. Pacific Daylight Time. So after you register, you'll receive a confirmation email containing information about joining us online. And we're going to hope that you stop by the Walk Your AS Off Zoom room. We'll be there all day long, and you can meet fellow walkers, share stories, see old friends, and encourage your teammates to keep going. They say motion is lotion, and we can't agree more. SAA is ready to virtually walk with you virtually. SAA is having a global day, and prizes will be given throughout the event. Now, at the heart of this new event, Walk Your AS Off Day, is you and your community. Who walks with you, even on the tough days? We invite you to post photos and videos using hashtags, hashtag Walk Your AS Off and hashtag WYASO. We'll display them throughout the online event. Because ultimately, we're building a healthy habit, a habit of walking that will carry you far beyond May 3rd and into the rest of 2026. So, join the movement, okay? And prep for May 3rd, 2026. So you sign in, log steps, join the team, recruit friends, fundraise, which is encouraged, and share and wear. Simply sign into the SAA website and you'll find the step counter waiting for you like always. It's as easy as logging your steps. Register online by scanning the code that we'll provide, and if you have any questions, you can reach out to us at info@spondylitis.org. Then you can join a team or create your own. The SAA home team was always looking for more walkers, but of course you can create your own team. And you can recruit others to walk with you or on their own. The more the merrier. You can also set up a peer-to-peer fundraising page to share with your friends and family across your social media sites. That's for SAA. Please work with your local ankylosing spondylitis organization. They may have something similar that we have, but you could always fundraise for us too. So that's it. Wear your Walk Your AS Off shirt and share content on social media using hashtags. We'll display posts and videos throughout the online event. You can tell your network about this event and help raise awareness about spondylitis. So that's it. It's a virtual Walk Your AS Off Zoom marathon. Can't believe we're doing this. SAA is committed to being there for you all day on May 3rd, 2026. And on that day, Zoom will be the place to find your happy pace. It's our way of walking with you, and we're with you every step of the way. Thanks so much for being part of this, and we're so excited to get going. Okay, bye-bye. Have a good day.
Thank you so much, Sean, for your video. Lara has just asked in the chat about, does that mean that Walk Your AS Off is only for May the 3rd, or is it still for the month? It is absolutely still an extended event. So they are doing a, they've got the event on the 3rd of May, which is a Zoom event, but the Walk Your AS Off will last for May and actually onwards after May as well. They'll want it. They're hoping that people will walk for a longer period of time. And when it comes to the fundraising as well, obviously the fundraising is encouraged for the SAA, but obviously you can fundraise. I encourage people to fundraise for your own organisations as well. I know that's something that NAS in the UK certainly does, and others also do. Thank you so much for sharing that, Sean. Agra, if you'd like to move to the next slide. Thank you. So I'd just like to thank the World AS Day Subcommittee again. We're really grateful to them for the input and for the guidance on the creation of the campaign. It's such an important part of making sure that the campaign is relevant to everyone. And also thank you again to Marco and Siade. If we move to the next slide, I've got another thank you, and that is to our supporters. We're really grateful for the incredible support that they give us, and we're really pleased to see Lara and others joining us. So thank you so much. From a industry perspective and also other stakeholder perspective, if there's anything that I can do to help you with your World AS Day activities, please get in touch. I'm really happy to jump on a call, have a chat and help with anything that you need to make it work for your organisation. The assets are obviously very much for our member associations, but they're also for sort of the wider groups as well. If anyone does have any last questions, then please do pop them in the chat. I will keep an eye on them. I can't see any at the moment. So before we finish, I do have one last thing that I'd like to tell you about, and this is a new project being led by ASIF. So excuse me for a little bit of scope creep here, going off the subject of World AS Day for a moment. So many of you I know will know about the IMAS study, which was a global survey of people living with axSpA. We collected data from over 5,500 respondents across 6 continents. So it was a massive study. This new study builds on the success of IMAS, and it's called the International Map of Axial Spondyloarthritis and Psoriatic Arthritis. So the new survey is going to focus on some new areas, and these are the topics that you, our members, told us are most important to them. They include the diagnostic journey, physical health, including pain and quality of life and comorbidities, stroke EMMs, psychological health, difficult to manage cases and the treatment of refractory disease, obesity and excessive weight impact, and treatment availability and escalation, healthcare utilisation and economic cost analysis. We're really excited that we've received funding for this amazing project. The most important part of this project is obviously the collection of the data. So we need information from people living with axSpA and PSA to demonstrate the real world challenges of living with these conditions. The data collected will be able to be used by patient organisations at a country level and at a regional level to demonstrate personal, societal and economic cost. And you've got the opportunity to be part of this project and help us really make some noise about the reality of living with axSpA and PSA. So if you'd like your country to be part of IMAP, we would really love to hear from you. We also have the opportunity for someone living with PSA to join our steering committee and scientific committee as a patient research partner. To find out more about that, or to find out more about being part of IMAP with your organisation and your country, please contact Jo Lowe. Her email address is on the slide there, projectmanager@asif.info. Drop her a note and you can have a chat with her and she'll tell you a lot more about the project. This study will provide invaluable data that can be used to advocate for improvements in the care received by people living with axSpA and PSA around the world. So it's really important, and we know it really will make a massive difference. So we're really excited about the project. If you do have any questions, drop Jo a note and she can answer them for you. Thank you, Aga. So I'm just looking, I can't see any other questions. If you do have any questions or I can help in any way at all, please do give me a shout. My email address is communicationsmanager@asif.info, and I'd really be very happy to jump on a call to have a chat to you. We hope that you'll join us in raising awareness about axSpA and the associated conditions on World AS Day. Please get in touch with me about translating the videos as well. As soon as they're available, I'll be sharing them with you. Obviously, all the materials are available from today on the website, and you're welcome to start translating those as well and adapting them for your own use. We're really excited. It's going to be the best World AS Day we've had so far, and we're really happy to partner with all of you in that. Thank you so much for joining us. Really excited about seeing you all and working with you in the future. Aga and Ravi, I don't know if you had any last words. Oh, Ravi, you're on mute.
Ravi, you're on mute.
So no, just looking forward to hopefully seeing all of the wonderful things that you do and all the noise that you create. Yeah. Any support needed, please come back to Jo. We're here to help.
Fantastic. Thank you so much. And Ravi and Aga, thank you so much for everything you've done to get us to this point. Before the webinar. That's always a good thing. Thank you so much. Lovely to see everyone, and have a great rest of your day.
Thanks, everyone.
Take care.
Bye.
Thank you.
Bye.
Bye.
Bye.